Yep, good to go, Councillor.
Okay, Mark, thank you. Good evening, welcome to this meeting of the Community Partnership. I will chair this meeting due to the lack of volunteers once again from the community. The last volunteer is now stepped down, so we'll be looking for a volunteer again for the next meeting. So hopefully we get one. Any apologies, Mark?
Christine, do you have the details for it?
So, yes, Councillor, we've got 2 apologies, Anne Innes from Case and John Wilson.
Okay. Anything arising for the minutes of the last meeting?
Yes, can I comment about the minutes of the last meeting?
Who's speaking?
It's Brandon Williams.
Right, Brandon, okay.
Only to say that the minutes don't appear to show anything about the meeting discussing the new community hub.
Right, that's on the agenda for tonight, Brandon.
Right, and also, would it be possible for the minutes, when they're produced, to include a link to the recording so we can go back to it and listen to parts in case we want to refresh our memories, please?
You can go back. All you do is go to the North Lanarkshire website, put in the date and time of the meeting, and that'll come up, Brandon.
I'm afraid I struggle to find it that way, so it would be useful if it was in the minutes.
Okay. Right, that's fine. We'll get the officer to take that on board to you.
Thank you.
Chair, it's Mark Costello. Can I come in a wee second on that?
Yes, Mark.
Just to say, we've been looking at the minutes, and we will be going forward. We're hoping to produce just an action note from the meeting rather than a full verbatim minute on that. Given the fact we'll also, and just to include what Brandon's saying there, we can send the link, and along with that action note, and we can put that out even earlier after the meeting, so that people have got that to look at that, so they can access the YouTube live stream. That we'll make sure that's made available for people as early as we can. And as I say, we will be hoping to produce an action note rather than a full verbatim minute going forward. Thanks, Chair.
Okay, we're going to move on now to general business and board updates. As you'll see via your agenda there, you've got 7 attachments.
Councillor McLaren, apologies for interrupting.
Okay, right, Alice.
Item 2 on the minutes. May I extend thanks to Inspector MacLeod for the attention he's given to that matter. Thank you.
Okay, Alice, thanks. I appreciate that. We'll move on to where there are 7 attachments here. We're not going to go into reading every word of these 7 attachments. These attachments are for you to be noting and noting only. But Matt and his officers will touch on some of the things within these attachments. The Head of Service, Community Champion, Nicole Patterson. Is Nicole there, Matt?
Sorry, Chair, it's Andrew McPherson who will be
Is Andrew taking that one? Okay,
yeah, Andrew's here for that, yeah.
Right, Andrew, you carry on.
Want me to take that point now?
Yes.
Yes, yeah, okay. Yeah, thanks. Thanks very much. By way of introduction, I'm Andrew McPherson, one of the heads of service in North Lanarkshire Council, and the purpose of me joining this board and coming along today really is to outline the role of what's been described as community champion that the council has now introduced. Really, I think everyone agrees, obviously, that local communities should be at the heart of what we do as a public service. And the introduction of the Community Empowerment Act really put that in a sort of legislative footing. And the response to this within North Lanarkshire was the creation of the North Lanarkshire Partnership, and probably more importantly, was the creation of the 9 community boards across the area. And the purpose of these boards has been obviously discussed in detail with everyone in this group. I'm not going to go into that because you'll be far more knowledgeable than myself. But rather to say that following the creation of the boards, there was a realisation within the council that there needed to be a more direct relationship between the council's corporate management team and the communities that we actually serve. And the purpose behind that was to ensure that, firstly, that the overall corporate direction, if you like, of the council and the plan for North Lanarkshire was and continues to be aligned to the overall needs of the local communities. That doesn't mean that the council will agree with everything that the local communities need, and neither we accept that local communities agree that everything that the council would like to introduce. But it's important that we do have that, and both of us are incorporated into the overall decision-making process as to what actually happens at a local level. There also needed to be a long-term commitment to the work of the council's communities team, who I think everyone would agree that certainly Matt and Leanne and everyone in their team has done a fantastic job over the last couple of years, getting us to the stage where we currently are at with the creation of the community boards and the soon-to-be signed off local outcome improvement plans. And thirdly, and most importantly, the need for this sort of a direct, more of a direct relationship with the council and the community was that the way in which the council and its partners deliver community services will have to change. Although our budget setting process for this financial year, and indeed potentially even next, will not be as painful as what we've had in recent years, there is a full expectation that come 2023-24, the country as a whole will have to start paying for the pandemic. Everyone expects and agrees to a certain extent that the funding for the NHS and education is something which we have to protect. But the consequence of that is that the inevitable shortfall in public spending will then sit with the other frontline public services. Now, I can't speak for the police or the fire service here today, but I do know that the council services are under huge financial strain at present, and a further reduction in funding will, at best, not be easy. So we have a couple of years warning that this is coming, and we have this time to look at a different approach in the delivery of public services across North Lanarkshire, one that puts local communities at the heart of the service delivery. But in order to really achieve this improvement in our local communities, both communities and public agencies have to work together as a collaborative, as one can be successful without the other. And if we don't work as a collective, then really we're both destined to fail. So the question for the council really then, how can we deliver this more integrated approach between the corporate management team and the communities? And the first thing that the council did was to review the overall corporate management team. That's now been done. The team meets every fortnight and incorporates all 19 heads of service that are in the council. And then the decision was then taken at that time that 9 heads of service would be assigned as community champions, and then they'd be allocated to each of the 9 boards. Now, as I mentioned just before, that the new approach this is not a short-term strategy. We know that the plan for North Lanarkshire, and indeed those plans that are contained within the LOIP, are long-term objectives. So it was also agreed that those heads of service would remain in place for a period of 3 years, with a review to be undertaken in around about 30 months. The purpose of that sort of timescale is to ensure that there's myself and my other sort of colleagues could grow, and hopefully a positive relationship can be built between the heads of service and other members of the board. But also it gives myself and the other heads of service time to build an understanding of the issues that are common across all community boards, but also, and probably more importantly, those that are unique to the board that they represent. Now, unfortunately for everyone here, perhaps is for the Northern Corridor, it's myself that's been assigned as community champion to the board. And I have to say at this stage, the exact definition and role of the community champion is really still being developed in a report on outlining the intention would be the North is going to the North Lanarkshire Partnership Board on July. It would be my intention to circulate, if it's okay with yourself, Chair, I would circulate that report to all members of the board and ask at the same time that if anyone and everyone could put in their comments as to what they would expect from this, both from myself and the general role as community champion, then that would be great. Because there will be a final report going to the council's corporate management team at the end of September, finalising and confirming the role of that post. I've got my own thoughts on what I think it should be, but I can tell you what it's not. I'm not going to be somebody who's here that anybody can contact to report any specific issue. For example, a bin being missed, or an area of grass not being cut, or litter in a certain area, because we've already got channels for that. But rather, I think that the community champion will be someone who will work with the board, the CMT and the communities team to see how best we can deliver as a collective on the key themes which have been outlined in the LOIP. So I think on that point, if it's okay with yourself, Chair, I'll stop there. And things that, if I can just commit to sort of maybe 3 things just for the action note, if you like. I'll arrange for a copy of the report to the NLP board to be circulated. I would ask if anyone has any comments on how they consider the role of the community champion, then they could maybe forward it direct to myself or through Matt or Leanne. Again, apologies, I'm unsure the actual mechanics of how that would work. But also it goes without saying that if any of them wishes to discuss this directly with me, that's not a problem at all, and I can certainly circulate my contact details to everyone on the board. And that's me, Chair. Thanks very much for the
Okay,
time.
Andrew, thanks for that comprehensive report, and everybody hopefully will take it on board and fire off their ideas to you the way things should be run. Matt Castell, it's flexible funding report. Matt, are you coming on in the flexible funding?
Thanks for that, Chair. Just to refer to the report that was issued along with the meeting invitation, the report provides information relating to the flexible fund and the tackling financial insecurity funding streams which have been allocated for local initiatives in North Lanarkshire. This funding is intended to support individuals and communities impacted during the COVID-19 pandemic. Community boards asked to note the funding arrangements that have been implemented, and further information will be made available to the community board as required. The report details the areas where additional funding has and will be made available. That's really all I've got input for that at this stage, Chair.
Okay, Matt, that's great. As you said, it's on the notes here. Once they read them, if they're looking for any information, we can do it through that. Community partnership updates, Matt, it's you again. Okay, Matt, you there? You're on mute, Matt. Matt, you're on mute.
Yeah, thanks very much, Chair.
Right.
What I wanted to raise, you'll be aware at the last board session, the last board meeting, we discussed board development sessions, and just to give you an update where we are with this at this point, this is just to highlight at this stage that the board members, as I've said before, are very important and critical in achieving the aspirations of taking forward the community boards as effectively as possible. And as Andrew mentioned in relation to the role of the community champions, we want to work together in a positive way to make the boards a successful model, leading on a recovery and delivering on the plan for North Lanarkshire. In the board development sessions, we want to cover a number of areas. Some have been mentioned before. Some development areas have been identified, but we want to hear what the board has got to say about that. Some of the things we've considered have been about partnership working, community engagement, role of the chair and members of the board, decision-making processes, participatory budgeting, the local development programme, the council and other partners' budget processes, community asset transfer, mental health strategy and other health strategies, community safety issues. These are just some of the things that we've considered, but we want to hear, and I'll go through a couple of mechanisms with you very briefly and how you can input to that. So what we're looking to do is to agree the initial areas for development, what areas you want to be considered for as part of the board development sessions, some of the ones I mentioned earlier. And we're asking if you've got some other ideas, we're looking to issue a survey in a short time that allow you to access that. And we're looking for a representative from the board to be part of a group who can help us develop the best way to engage with the local community in relation to this, but also to determine the best learning methods, because everybody can learn differently. A number of different ways. We want to work that out. That will then be sent out to board members, allowing us to further identify common themes for inclusion in that. As I say, look at the preferred learning methods, which will be taken into account, and hopefully come up with a blended approach, including online and interactive approaches. The timeline for that is over the next few weeks. The survey will be issued. After feedback comes in, we'll look to launch the community board development sessions towards the time of the next round of community boards. And that will be then, feedback from that will be monitored and allow us then to consider what we take into the development sessions going forward over the next few months. So the ask here tonight is if anybody is interested in being part of that group to consider how we take that forward, then please let us know. You don't have to tell us tonight, Chair, but if there's anybody's got anything they want to put into that, then they can contact us directly and we can consider inclusion in the group. Thanks, Chair.
Okay, well, Michael McPake, do you want a question there?
Not so much a question, Chair, just a comment. And I think we've landed very lucky, and not want to embarrass you here, Andrew, and getting our community champion is Andrew McPherson. I think he's one of the shining stars at North Lanarkshire right now, and I think any development days or whatever meetings should include the community champion Matt. I'm sure Andrew will come along and be very informative. And that way it'd be groundbreaking for everyone, just to get to know Andrew a bit better. That's all I would like to say, Chair.
Okay, Michael, that's noted. Thanks for that. Matt, I think it's Leanne next for the Loics, is that correct?
No, I think it's
You've all got one to do?
Yeah, I think it's the local development programme.
You've done the board development there.
Yeah, no, it's a local development programme, Chair.
Right. Okay, and then it's Leanne next after that.
Yeah, so just on the report, again, it was issued in relation to the local development programme. This report provides an update on the current projects within the LDP in the Northern Corridor and gives details of the future capital budgetary position in relation to the local development programme. You can see from the appendices in there that for year one of this capital programme, there's £127,440 allocated to projects in the Northern Corridor. Our current holding list that we have there just now has approximately £250,000 worth of projects at indicative budget costs. So it gives an idea, as it were, it's not something that's going to be delivered in 1 year, but as you can see from that appendix 2, that we do have further funding being allocated for subsequent years to support projects. And that's something we want to work with the community board on going forward. So that, as I say, there's potential projects there. We will work now to identify the feasibility of taking these projects forward, which we have already been approved in principle, and move to delivery where possible in conjunction with the local communities, ensuring that there's effective consultation and looking to see getting a balance between the budget limitations, and the projects, looking to deliver the projects over more than one financial year, and then looking at further projects down the line to be delivered in subsequent financial year in subsequent annual years. We'll ensure that Community Board is kept informed of how these projects progress, and we're asking the local communities who are aware of the projects that are on the list to work with us to ensure that we can work up proper and feasible designs for projects that have been suggested, and we'll come back in touch with you to pick up on that. Projects will be prioritised on the basis of wide community support, links to the local outcome improvement plan, and they can be delivered within reasonable budgets and are consulted on positively within our local communities. That's all I've got to say on that one, Chair. I'm happy to take any questions or points.
Is there anybody get any questions? No questions?
Yes. Could I just ask, there are projects on the plan that were delayed because of obviously the COVID pandemic. Could those not be picked up and run with straight away?
Yep, Brandon, that's what we're going to look at. We're looking at the projects that have already been approved in principle, and these are the ones that we will be looking to take forward. The projects are already we understand these are priorities for the Northern Corridor. They've been identified in that way already, and we will look to take that forward as best we can. We will consult further with our local communities about more detail in relation to the projects, and we'll look to take those projects forward. Again, we are limited in budget, but we'll do what we can. But we're in a better position in that the council has committed the money for the next 5 financial years. So as I say, in year one, we have £127,000. That reduces for the next 4 financial years to just under £96,000. However, it still allows us to undertake a number of projects within the local community.
Okay. Alice?
Thanks, Councillor McLaren. And again, Matt, may I ask you at item 9 on the agenda, I believe I've made reference to projects that are on the holding list for the local development programme. And am I correct that these are the ones to which you are referring and the ones that you would be beginning to deliver on? These are the ones for steps. There's 5 listed there.
There's a number of projects there that are on the holding list, and we need to determine across the whole of the Northern Corridor which projects are going to be deliverable. We'll carry out feasibility studies within projects, but we're not going to be able to guarantee that all the projects that are on the agenda item you've put in there are the ones that will definitely be taken forward. But we will endeavour to get as many projects delivered as we possibly can, following consultation with the local community.
Right, thank you.
Right, we'll come on to that a wee bit later, Alice. Right, we're going to move on. Leanne, did you give us the LOIP
Yeah, there's
support?
another couple of hands
A few
up.
people with hands
Right,
up,
I can't see
Councillor.
them. You'll need to put your hand up so they can see you. Who's first then?
Claire
Right,
Williams,
Isabel
Isabel Kelly.
Claire. Claire.
Hiya, it was just to ask, you said groups should get in touch if they had submitted these ideas in the past. Who should we get in touch with, and what's the best way to do that?
Just contact ourselves through the Community Matters, Claire, please, and we'll pick that up and we'll ensure there's proper engagement with you in relation to that going forward.
Okay, thank you.
Isabel, see your hand up there.
My question was kind of related to Claire's. Matt, the paper you issued gave you the criteria, which I don't have a problem with, but what it didn't do is say actually how you could put a project together to be able to put in. There doesn't seem to be a standard forum where you can put rough details and draw it to your attention rather than just submit it. So it was just to clarify, is there that sort of a forum around? Had I missed it, or is there nothing like that to put down in paper other than organisations writing to you?
No, that's a good question, Isabel. We've just completed recently a new forum for this, for local groups or elected members even to put forward projects in an area and ask you some general questions, just as you've referred to. So what we'll do, we're going to finalise that this week, and that'll be sent out to all the community board representatives for information, so that we can, if anybody's got further applications or further ideas for projects, then you can put it on that, and we can bring that into our team for further consideration. I'll make sure that's sent out to everybody over the next week or so.
Okay, quite happy with that. Is there anything else? Because there's a lot of names here.
Carol Henderson's raising the hand,
right,
Chair.
She's not on screen.
Yeah, I can.
Right, Carol, I see you now. But Carol's here that there are no pictures, so it's hard to pick these out. Right, Carol, would you like to come in and keep it brief?
Can I ask for projects that were put on for a few years ago, was that money not set aside and carried forward, so it shouldn't be coming out of this year's budget?
No, there was no budget carried forward for a few years ago. This is a new budget allocation that's been given to the local development programme.
Right. Okay.
Okay. Right, Leanne, I'll give you a turn now.
Thanks, Councillor McLaren. I'm just going to give a brief overview where we're at in terms of the development of the LOIP, the local outcome improvement plan for the area. And obviously there's people on the call who have been involved, so if anybody for the community wants to kind of chip in at any point, that's fine. There was obviously a short life working group that was set up by the community board to develop the final kind of draft local outcome improvement plan for the area. That was all based on the outline of priorities that were agreed at the last community board meeting, and obviously that was based on work to identify the priorities through community engagement and stakeholder engagement and looking at kind of data. So the short life working group over the past few months has been engaging with the community board and obviously bringing reports and then we've been feeding information out to the community board at kind of regular intervals and circulate the draft LOIP's now being circulated. So any feedback that's been received over the past, or up until basically I think yesterday, has now been incorporated into the draft document. The changes have been fairly minor, and obviously the subgroup have made some changes recently as well. So I think what we've circulated just over the past few days was the kind of final draft that we're hoping to have endorsed at tonight's meeting. Just to make it you aware that when that was circulated, the document is obviously still in draft. And it will be until the board endorses it. And obviously the document's currently not particularly community friendly and we accept that. Really, it's a Word document right now and the format will be changed. We're really just looking at the content and that people are quite happy with the content of the overarching document. The intention is then that we would get some design work done and we would develop a more kind of interactive online document for publication that people could then kind of click in and out of the bits that are most relevant to them or for the information that they need. And we'll also produce a summary version that can be made available as required for people who don't necessarily want to go online but don't want a big massive document to go through. So what we're kind of asking for endorsement for tonight was the document that was circulated to you earlier in the week, or late last week, sorry, and that's the kind of final overarching LOIP document, which gives all of the kind of context, background information, how the partnership operates, etc. And then it gives a brief summary of each of the priorities that have been agreed. What we'll then have is a template for each of the priorities, which the subgroup have started to work up, and that's been produced for each of the priorities. And as work progresses, these kind of templates will be used to provide regular progress updates to the community board around individual priorities, so up to update on performance. So following approval, hopefully tonight, of the overarching document, the next steps will include that we'll look at design work and publication and launch of the overarching LOIP priorities across the Northern Corridor. We would then propose that we know that there's further work required under each of the priorities, because I think at the moment that, you know, the templates are saying kind of I've got pretty much kind of developmental actions, so things like we need to find out a bit more about this, we need to do some more mapping, we need to look at the data, we need a baseline. So we would propose that we probably need to do a wee bit more work under each of the priorities, so possibly hold a kind of stakeholder session specifically, so bringing together, say it was I'm trying to think of one of the ones for the Northern Corridor. So say it was around a kind of mental health or poverty, or I think there's loads across the different areas. What we would do is we would bring together the kind of key community and voluntary organisations that are maybe operating within that kind of field, along with the council services and other partner agencies, and bring them together to really start to look at the detail of what that priority will, how it'll start to shape up in terms of actions in the Northern Corridor. What we would then propose is that to the next community board, we would bring a report that kind of outlines what the proposed approach is under each of the priorities and what the delivery structure is. So who would be leading on each priority? It might be some may be led by a community organisation, some might be led by a council service. It just depends, as Andrew was kind of touching on earlier. This is very much a partnership approach, so it's about who's best to lead should be leading, and we would be supporting that approach. So really, we're just asking for endorsement tonight of the overarching priorities so that we can move to the next stage of getting the design work done and starting to get information on the council's website to enable us to move into getting really kind of drill down into the individual priorities and start to develop the detailed actions around those. I know that there was one comment that had came back around some of the information. There was one comment that came back in, or a few comments around the kind of priority around health and how it relates to the Moody's Burn West area and things like that. And we've kind of updated the document since it was circulated, just based on the feedback that came through the subgroup. So it was just that's all we're looking for tonight, is endorsement to kind of move to the next stage and get some information developed to the stage that it can go on the council's website and other partners' websites and can be shared across the community, a kind of live document, and we'll then bring back a report as we develop work over the kind of summer months. We'll bring back a report that looks at how we would see delivery kind of starting to take shape around each of the individual priorities and what the actions might start to look like.
Okay.
That's me, Chair.
Thank you. Right, hold on. Isabel Kelly, you want to come in before we ask for an endorsement for this, Isabel? Isabel, as much as I don't like saying it, can we have your sound on? You're on mute.
Now, John, don't be like that. Leah, thanks very much for your comments, especially about Moody's Burn. It's quite difficult when you're a resident, because actually, with all due respect, half of what you say is double Dutch to us. And when we actually looked at the document you created based on the working group we were on, we couldn't actually recognise some of the points that we raised. Now, we realise that this is a higher level document and the detail is probably going to be behind that. But what we need is a guarantee about what we actually said in that working group and the priorities that we asked, especially in health, to be addressed, that we actually see that coming out in action plans. And when we look at the document, we can't see that. So I'm all for endorsing it, but I would really like your endorsement to us to say whatever was discussed, the minutes, the information that we've put to you, we're actually going to see that as action plans, because the document we're looking at now doesn't give us that detail.
Okay, I'm happy to respond to that, Chair, if you're okay with that. Isabel, I'm really sorry that you feel like that, because I thought that the document had been developed in partnership. I thought we had developed it kind of collectively, so I really am sorry that that's how you feel, because the document has been shared quite a few times in the past few weeks with the subgroup, and any comments that have been brought back have been incorporated. I think if you remember, with these plans, we're having to make sure they reflect community need, but also, as Andrew kind of pointed out earlier, we do have a statutory obligation within the Community Empowerment Act, so we do need to produce plans that also meet those requirements. So they do need to be fit for kind of both purposes. So I suppose there is a bit at the earlier part of the document that's a lot more about the process and the kind of structures and how things work in North Lanarkshire and what the ambition is. In that overarching document, it is a summary of the priorities, and as I say, that the action templates is where all the detail will be. I think there was a real mix of information kind of coming in from across communities, and then when the subgroup started to develop the kind of priorities, and there were some things that were probably too detailed to go in that overarching document, but that would sit in the action template. And I do hope that we can kind of have a look at that and make sure that those action templates. I think that's why we want to have almost a kind of stakeholder. We had stakeholder sessions to look at what are the priorities for the Northern Corridor, but there is a need to look at each of the individual priorities. And say, right, what is it that we know roughly what we're trying to achieve here, but do we fully understand, what that means, how it links to other strategies and plans, and how and what the actual actions are going to be, so we're avoiding duplication and things like that. So I would hope that some of that more detailed information will absolutely, and I think it already is, in the action templates. It's just that the document that we've produced just gives a kind of summary of the priorities. So what will happen is, that's what will be published, but if somebody wants much more detail, we can certainly send them the template with much more detail around that particular priority. I think the problem with publishing those is that we would hope that they would be used as a reporting tool, so they almost might change quite regularly. So we were trying to capture the priorities, I suppose, in a way that we could publish them for a number of years without them having to keep being changed, whereas the priority templates are where we'll be able to say, right, here are the detailed actions, and as things develop and as the board develops, the priority won't change, but the actions might change. So I'm really sorry that you do feel like that, and we will obviously work with you to make sure that what the kind of detailed priority templates look like absolutely reflects what the community wants, but also what the partnership requires in terms of meeting statutory obligations, and also in terms of the kind of priorities for the area, for the North Lanarkshire as a whole.
Okay, Isabel, you're quite happy with that? The officers will take that on board and get that to you. Okay. Brandon, you're on mute.
Chair, sorry, Jen,
Yeah,
I think
sorry.
Bill Kelly was speaking there, but our microphone was on mute.
Right, I'll go back to Isabel. Brandon.
I was only going to say I was not a participant in the subgroup, and I'm surprised that health and social care isn't one of the headlines on the document, because that is something that is always being discussed within this group. So I fail to understand why it's something that's going to appear in the detail when it's really something that should be at the top of the list.
Okay, Brandon, noted. Isabel, is your microphone going to mute there, or is there something else to add?
But just to say, Leanne, I don't have a problem with the paper trail that the council has to produce. What my comment was, when looking at it, we didn't actually see all of the priorities that we discussed. Now, if the methodology brings that out at the end of the process, I don't have a problem. My problem would be that in a year's time or 18 months' time, we haven't actually addressed any of the issues that we detailed, and then for some reason somebody says to us, oh, well, it wasn't in the front overarching document. What we're saying is the level of detail that we produced might have been too much, and knowing the format that you're used to working with, fully accepted. But at the end of the process and during the process, what we actually identified as priorities is addressed in some way that we see it in action plans and outcomes.
Yeah, and Isabel, I absolutely understand what you're saying. I suppose what I'm saying is I'm disappointed that that's the case, because the document was produced with the subgroup and was shared, you know, on several occasions with the subgroup that was developing those actions. So you shouldn't feel that it's the council that's written this document and just put it out. You know, it really should feel like you kind of co-wrote the document with us, albeit we did some of the, you know, a lot of the kind of actual writing. You should certainly not feel like the document is a million miles from what was agreed with the subgroup. So that does make me feel quite concerned that you feel like that. So I think we probably do need to maybe look at that. I think the fact that it's been raised tonight that the subgroup that developed the plan don't feel, or some members of it at least don't feel, that it reflects the priorities that you agreed is quite concerning. So I think we do need to look at that. And if you want a more explicit priority around, you know, health, then we do need to look at that. I think we would want to try and move to the kind of design stage quite quickly, but if we need to take another couple of weeks to look at the wording and then hold a kind of separate board meeting just to, you know, agree that I'd rather do that than people being unhappy or feeling that what they had said was not reflected. But I do find that a wee bit worrying. So happy to take that on board. And if I know there's a couple of other people with their hands up, and I know I'm speaking, but there was other people in that group, so and other people in the group who maybe want to kind of come in and speak. So I'm happy to take, you know, views if people feel that they want to have a separate meeting just to kind of sign off. Take a couple of weeks to make sure that we get it right and sign it off.
Okay, Leanne, so you're quite happy to look at that sub-board and go through the paperwork to make sure it all meets everybody's requirements. Does that suit you, Isabel? You're quite happy with that, Isabel?
Yeah, I think, Councillor, that what I would say, sorry, just to jump in there, the only thing I would say is we wouldn't want to wait to the next community board meeting for sign-off, because that would hold us back. We could possibly maybe have a special board meeting if we need to, and invite people along to kind of do that final sign-off.
Right. Now, there's nobody sitting with their hands up, or sitting behind the screens or on. Well, I can't see them in the screens.
Teresa has got her hand up.
I'll get my hand up. Teresa Aitken, not Christine McAnally, as it says in the screen.
Right,
well, I was part of the subgroup. One of the concerns that we did have was the health, you know, the priority that we had identified in relation to health. But listening to you, Leanne, and, you know, for me, these priorities are actually the baseline that we're going to be working from. You know, so if you can assure us that everything that we've identified is going to be on the back page, as you say, for us to be working on in subgroups to take this forward, then, like Isabel, you know, I'm happy to endorse it. I can only speak for myself, but I think the biggest thing that came out of anything that we did identify is community engagement, and that we as 6 or 7 people sitting around a subgroup cannot speak for every single community, and we have to go out to the community. You know, priorities might change, communities might be looking to address different priorities, and every strand of what we've identified. But I think, you know, I would be happy to endorse it if there's assurance here, and I think maybe what you've suggested is that we have a special meeting to take this forward, because I know that it has to move forward. But for me, actions are what I'm looking for, and I think that we've been going on long enough. You know, we're a year now down this community board, and for me, actions are very, very important. I think, you know, at the heart of it is that our communities are sitting out there waiting on us coming out, you know, to work with them. And take them forward, basically, you know, especially after COVID and the pandemic that we're in. I think the important thing is that we move this on as quick as possible. So I think what you're trying to do is assure us that behind those baseline priorities, you know, that is everything else that we've identified, and I'm quite happy with that. But a special meeting then to take that forward and go into more detail quite quickly, I think would be important.
Thanks for that, Teresa. appreciated. Who else has got their hand up that I can't see here because your pictures are blanked out?
Carol Henderson.
Carol?
Just to reiterate the same thing, I think health and social care is a major thing within the Northern Corridor, and I think it is very important that it should be on the front document. You know, at every community forum meeting, it's raised in one form or another, and at the last community forum meeting, the end of last week there, this actual issue with it not being on the document was one issue that was raised and, you know, was spoken about for quite a period of time. So I do think, you know, I can understand reassurances and Leanne giving reassurances, and, you know, personally I don't have an issue with Leanne giving reassurances. However, the council as an overall have given reassurances in the past and they've not come to fruition. They've not been held up. So I would rather have the thing in writing, with it being on the front document, and have it there so that, you know, the council can't go back in future years and not uphold, you know, the agreement at the end of the day. And, you know, I'm quite in favour of having the document redone and have a special general meeting for it.
Okay, that's fine.
Councillor McLaren, can I just very quickly make
Yes.
a point in response to that, if that's okay?
Certainly.
We happy to have a special meeting and work over the next few weeks on the kind of wording and things like that. I think we need to just make sure that we're linking back into the fact that these priorities came from engagement with the wider community. And yeah, there was a lot of reference to health and social care and health kind of services and things like that. I think what we do need to be realistic about is the types of things that we put in there and making sure we're engaging with health at probably a number of levels in terms of what types of actions end up in there. But anything that's been agreed through the subgroup to date will absolutely is already reflected in the document that sits behind the wider kind of plan. I suppose I just wanted to reiterate the point that's been made a couple of times tonight about these documents do not belong to the council, so it's not about the council giving you reassurance. This is about us working with you to develop priorities for your area, and look at where the council might be able to lead or deliver, where community organisations might lead or deliver, you know, where NHS, police, fire. This is about a partnership approach. So I just want to make it clear that, you know, this is not in any way about the council saying we're going to go away and write a document, because that's not what's happened, and there's absolutely no intention to do that. So even in terms of those kind of templates that sit behind the document, the information that's in there is very much come from the subgroup, which has very much come from wider engagement with the community. And I just wanted to make that very, very clear that you know, even what goes in those from moving forward will be dependent on the kind of wider engagement, the engagement that Teresa mentioned. If we need to do stakeholder work to look at that specific priority, it will be informed by that rather than the council saying they will or won't do anything. These are very much partnership plans.
Thanks for
Thanks,
that.
Councillor McLaren.
Thank you. Right, we've exhausted that one, and Leanne, we're going to go for endorsement. Can everybody agree to endorse this? And we'll have another, Leanne will set up another meeting to ratify everything else. All agreed? Agreed. Andrew McPherson, you're up for another report, Andrew, an update? No? Are you quite happy with the first one?
I hope not, Chair, because I've only got the one.
No, you're up for another one, but that's okay. We'll pass you over. And it's board and subgroups to Matt. Thanks, Andrew. Give you a beef right there. Matt, would you like to come in on boards and subgroups?
Just a standard item, Chair, in relation to the subgroups. This is something that's going to be identified through the work that's been undertaken through the local outcome improvement plans, and we'll pick that up going forward to see if any further subgroups are required in relation to the priorities for the board.
That's fine, Matt. Thank you. We're going to go into a wee bit of community matters here. I would like other groups to pay attention and have a look at the steps I've done. They've done it very professionally, and they're not springing things on in the night. They're giving us questions to hopefully we just can, if we can get some answers straight for the officers on their requests. And it'd be quite a good idea if other groups had the same. They want something on the agenda, put it in writing, and the officers know before the meeting that they have some answers.
John, can
Alice, you put your hand up there.
Sorry.
Yes, please. If I may ask Matt, in reference to the subgroups, Matt, I had subscribed to education and planning, that there should be two subgroups. Those were my suggestions. Do you have a list of the previous suggestions? Because this was asked at a previous board meeting.
Yeah.
Matt, can I answer that maybe?
Sure, please, Christine.
Just so you know, Alice, I circulated a list of the suggestions that were put forward prior to the last community board meeting, but I'm happy to recirculate that. But it was circulated and those things were actually included within that. So just to let you know that that has been done.
Thank you.
No problem.
Evelyn Ryan, had you your hand up there? No. Right.
John, I've got my hand up.
Right, okay.
Just to say, Matt, I think what Alice was trying to say there, we did not envisage that subgroups would be limited to the LOIPs. I think what we envisaged was if we put forward suggestions for subgroups, then we would, we would look at what we could achieve, what was realistic in terms of forming subgroups, but it wasn't limited to what came out of LOIPs. It was in general subjects. I don't know
if absolutely. Sorry, if I've put across that it's restricted only to what's in the LOIPs, then that's not the case. We are looking at, I see the other point there about the climate emergency, etc. But there are a number of things that we can look at. It doesn't have to be totally linked to the local outcome improvement plans, but these are things that may drive forward the delivery of some of the work that could be done. But we're happy to look at other areas where there is a interest in from the local community. And as I've said before at the board meetings, we'd be really keen for local community groups to lead on some of these subgroups and to drive these forward on an individual basis within the local community. So we're happy to do that.
That's fine.
Absolutely no reason why we can't look at other things.
Right, Matt, you want to answer some questions on Alice's concerns for a local community group on the agenda, the culture centre and Steps running track, the Allister play area, Cardown area funding support for environmental projects and Steps football pitch. Before you get into that, Matt, I'll give you a wee bit of information. This morning I sent on some pictures to the Chief Executive, to the Leader of the Council, Colin Walker and a few other people. Nicole Patterson at the state of the pavilion, the changing room, supposed to be changing room at Steps. We're requesting that we update this and get a new one. I've also asked to be considered for the COVID recovery funding. We've still got work to come back on all that, Matt, so if that gives you any guidance or any help. You carry on with that.
I understand. I think the ones that Alice was referring to are the ones you mentioned at the start in terms of the local development programme. These are projects that we can certainly look at and consider in terms of the local development programme going forward. But bearing in mind the cost of some of those projects as standalone would wipe out the budget of the Northern Corridor for even one or two of those projects. So we need to be able to prioritise the project. We need to timeline them over a number of financial years, but we're certainly happy to look at that in conjunction with other investments and other strategies that the council's looking at. Like if you're talking about a pitch improvements, that may be something we'll look at as part of the sports pitch strategy going forward to determine whether there's other investments that could be considered for that. So it won't all be related to the local development programme, but wider than that, if there's specific issues pertaining to those projects you're talking about going forward, again, we're very happy to look at that to see if other services, based on what you're saying, Councillor McLaren, in relation to the issues at the pitch. I think that was the one up at Cardown.
Yes, that's it.
Looked at. I'm well aware of that. I saw that when I was out on a walkabout with Anne-Marie before Christmas. Looking at that one, so we know about that one there, and we know it's costly to refurbish that. But these are certainly things that we could look at. But there's no way that the local development programme will be able to fund all of that. There needs to be partnership funding that looks at that to see if that's something we want to go forward. And that's part of an overall strategy that needs to be considered. But as I say, that any input from the LDP in relation to that will be certainly be recorded in the reports that come back to the board.
Okay. It can be looked at possibly through the COVID recovery fund. Greg, I've seen you putting a note on there about Mount Ellen. Aye, that could come under the basics of that as well. Mount Ellen, as you well know, the pavilion was setting fire a few times. I got it demolished because we were going to go for it for an asset transfer, and the day before it got burnt down and it ended up a safety hazard. But we certainly can look at the amount of Elm pitches when we start getting, hopefully we get some COVID recovery money through, if we manage to be successful on that. You quite happy with that, Greg? Okay. Right, I'm going to move on to now, Isabel, you're going to come in and something to do with health, but I don't think Evelyn's here at the moment. Is Evelyn, did she get through?
Councillor, Evelyn is on the call, but her sound is really bad, so I don't think she's hearing all the kind of questions that have been put forward. But what we can do is we can take a note of them and try and get that get answers to those questions.
Right.
Christine, she did message me saying she was on now, but I don't know if she's struggling again. I did get a private message saying she was now on, but I'm not sure if she's dropped off again.
Chair,
thank you.
Chair, Matt Costello, there's another issue on that agenda there from Teresa about a traffic issue in Ramon, Glenboig. I don't know if Teresa wants to come in on that one at the moment.
Right, we'll let Teresa do that one first then, because it's not in my sheet. Right, Teresa, carry on.
Coatbridge Road's coming up down through Ramon into Glenboig, the specialist in the landfill, and before that is a complete danger to the community. So what we're looking for is a possible traffic camera there before there's an accident. I mean, there's large bricks coming off these big lorries that are coming through that community that are landing on the pavements. I was up there last week at somebody's house, at an elder person's house, and the cars racing through there one after the other was just unbelievable. The noise was unbelievable, and there's definitely, you know, a hazard there because of the way the community's been built. Obviously, you know, there's nothing can be done with the side of the pavement. We're giving people parking access, so you've got cars kind of on both sides of the roads there, you know, that are parked. But I think really traffic camming maybe not work there, but we definitely need to look at some kind of traffic camera or something up there, you know, for the safety of the people that are living in that road up there in Ramon. So that I'm putting that forward, you know, for a camera. We can't wait in local development programmes, and we can't wait in participatory budgeting. Something has to be done before there's a fatal accident up there. I mean, people can't even come out and cross the road safely. They can't park their cars safely. When they come out, they can't go into their cars safely because of traffic going up and down the road. It's been a problem for a long time, and I know Councillor McPeak's identified it in the past. The people in Ramon have identified it in the past, and I think now is the time to get something done about it, basically.
Right, Teresa, totally
That's
agree
me.
with that. Totally agree with that, Teresa. And Michael and myself have a conversation along with the two local councils in that area and see what we can get done on that. Now, there's somebody been flashing up, they're wanting something to do with Moodiesburn and rats. Now, we'll bring that up under any other business, if you don't mind. Don't forget about it, bring it under any competent business because it's not on the agenda. But we certainly will have a wee conversation on that. Right, Evelyn Ryan, now Isabel Kelly's got a question on the hub and the health bit of the hub. Could you be able to answer it once Isabel comes back in? Are you there, Isabel?
Yes.
Isabel, would you like to put your question forward, please?
This came out of the community forum partnership in behalf of most of the people that are present at that meeting. We asked for a health centre within the Northern Corridor. That became a watered down version of a replacement of clinics in the school hub at Christon, and it seems to have slipped off the agenda. With the hospital and that decision being taken in to go to the other side of the county, if you like, we have 50,000 people in Cumbernauld, we have 10,000 in Cosaith, we'll be heading for 30,000 in the Northern Corridor, and we have also had word from Bells Hill, which is 20,000 in population, all stating they will not use the new hospital and they will use Glasgow. Now, if we're looking at community partnerships or the council's partnerships, is there any reference to Greater Glasgow in terms of that partnership? And we don't know what 120,000 people looks like in cross-boundary flow referrals. So if these people are going to go to Glasgow and not use the new hospital, what planning is taking place for secondary healthcare? And we look at the LOIPs and we look at the health outcomes, especially in places like Moodiesburn, and the lack of access to GPs. The recent survey that we did in Gapcosh, 47% of the people who participated in that particular survey stated they do not have a GP in the area, and they are going outside to Glasgow or from where they previously lived because they can't get on a list. So in terms of health, we think that there's major issues there, and it's not appropriate that we go to a group of GPs and then you have to leave there, go to a clinic, get blood taken. We're in the 21st century now, and this is the healthcare delivery that we're getting in the Northern Corridor. So we would like it raised at the highest level in terms of health priorities.
Evelyn, could you raise that for Isabel, that the traffic will only go one way? The Northern Corridor will be the only part that will be allowed to use that hub, not people coming from Glasgow to the Northern Corridor. Although Christ and Muirhead and Steps, we are still under Glasgow Health Board or the North Lanarkshire Health Board. We can pick a hospital to go to, but we're looking at this clinic is solely for the Northern Corridor. And I totally agree with Isabel on that. So would you take that forward for us, please? You're on mute, Evelyn. Evelyn, you're still on mute. Okay, Evelyn, you're definitely having connectivity problems. Mark, would you get that related to Evelyn and see that she gets word back to Isabel that our request that the traffic only comes one way? Is that you now, Evelyn? No, we can't hear you.
Wait a minute.
Right.
I'll try this. Hold on.
Sometimes if you put your video off and the sound comes on, if you put your picture off, right, try it now. No, it's not working, Evelyn.
You're on mute. Evelyn's back on mute again. She was off mute there and we could hear her, but...
You're right, okay. How's that?
That's fine, Evelyn. That's great.
Sorry about that. Yes, I'll raise that. As I say, obviously Kilsyth have got their own health centre and Cumbernauld have got theirs as well. The Northern Corridor clinic is basically to hopefully transfer the services in Glasgow, which has still been provided in Glasgow, particularly mental health, will transfer over to the Northern Corridor. So that's the plan. I do understand people saying you're going to the GP and then having to go to somewhere else to get your bloods and that taken. But all that will be finely tuned once it's up and running. But I will raise it anyway, okay?
Evelyn, it can't be finely tuned when there's no building. We're talking about a comprehensive health centre like Coatbridge and like Kilsyth, not the health centre that is being provided. That's not what we asked for. And although that's what's been delivered, it was a like-for-like service, but you were including mental health and drug and alcohol abuse because that was coming from Glasgow. That was not what we asked for. And when you consider the GP is the clinical expert as to how the community access the wider community network, we've got a serious problem with GPs. We've got a serious problem and we don't have a centre of excellence that can deliver routine primary care in the Northern Corridor. And we're looking at a population of 120,000 now looking to Glasgow. And we would like to know what the partnership is doing to plan for that. So it's a three-strand question. We want to know what they're doing about people in the north of North Lanarkshire migrating to Glasgow to get their treatment in secondary healthcare. We want to know what provision that if we get referral to Glasgow, Glasgow is ready to take these patients on. We want to know what can be done about the amount of GPs, and we want a comprehensive health centre. So that is what the inquiry is.
That's fine, Isabel. Now, Evelyn, it was communicated to myself about this, the new health centre, that it will not be a needle exchange and it won't be used for drug rehabilitation. It won't be that type of centre.
That's correct. That's correct.
That's fine. That's fine. Wally Dillon.
Thanks, John. I've got to congratulate Isabel Kelly in raising the issue, particularly about the lack of GPs within the Northern Corridor. And I want to make a direct referral to the situation here in Moodiesburn. Now, I mean, Moodiesburn, we're into the 21st century, and where are we? We're getting doctors' surgeries taken away from us. You look at the situation whereby now some of the people in Moodiesburn have now got to travel over to a smaller community such as Glenboig, and I don't mean that in a disrespectful manner to the people of Glenboig, but I think it's wrong that people have got to depend. I mean, it's not everyone who has their own transport to get to Glenboig. You're talking about an hour between buses. Now you take that in the middle of winter, some old buddies trying to go over there, then they've got to go get to Glenboig, then they've got to manipulate their way up the hill up to the doctor's surgery there. I think it's a real backward step. We're looking at Moodiesburn at the present moment of time getting bombarded like umpteen other places throughout the Northern Corridor, getting bombarded with new developments, and we can't even provide the basic necessities of a GP's surgery for the people in Moodiesburn. I think it's wrong. I think it's scandalous. I know myself and the other two ward councillors expressed their disgust when this was actually enforced upon the people. Right, I think we were about 3, 4, 5 weeks into the pandemic, and we were hit with the fact that our surgery was being taken away and the people were having to travel out with an expanding community. I think it's wrong, totally wrong. Isabel, please, we ask for your help. We ask for your assistance in this matter. Please, let's provide the people within this community with the basic GP needs. Thank you.
Thanks for that, Wally. Fully agree with you, Wally. Evelyn, you also take that one praised by Councillor Dillon on board?
I will do.
Okay.
And just to say that the GPs, it was at the time, we didn't find out till later on when the GPs had given up the building there and moved to Glenboig. As you know, they're contracted out, they're not employed by the health board as such, just to make that clear.
Okay, that's fine, Evelyn, thanks for that. We're moving on now to the input from community partners. Evelyn, we're going to let you stay on the line and do yours first because you've got connectivity problems. So would you like to give your report?
I haven't got anything on me just now, John, to be honest with you.
Okay.
I didn't expect to give a report tonight.
Right,
All I
that's
understand was just to give you an update about the new clinic, so to speak.
That's fine.
Okay.
I think you've got enough tonight anyway to get on with, and hopefully we get something.
Yes.
Okay, we'll move on to Brian Kane, the Scottish Fire Service. Brian?
Yep. I'd like to take the opportunity to introduce Crew Commander David Rennie, who's on the meeting tonight. He's the Crew Commander for Steps Retained Station as well. I'll let him have a wee talk to you at the end of my report. I think Christine Boyle shared this with you earlier on today. So our local firefighter training plan, they've been covering subjects including hazmat, which is hazardous materials, which was quite useful because we had the big gas governor was taken out at Mount Ellen during that training phase, so gave them a bit of experience. They were also doing health, safety and risk management and railways modules. With regards to our key performance indicators, when it came to accidental dwelling fires, within the quarter up to the 31st of March, there were none within Ward 5 and 2 within Gartcosh, Glenboig and Moodiesburn. Accidental dwelling fire casualties, that was a clean sheet. There was nothing to report there during the quarter, which was the same as last year at the same time. Deliberate secondary fires, we've had quite a problem within North Lanarkshire. It is an ongoing problem for us across North Lanarkshire. So Ward 5 had 3 during the quarter and Ward 6 had 4, which was a slight increase on the previous year and up on the 3-year average as well. But there's been quite a bit of community safety activity ongoing across North Lanarkshire, which it's not really reflected in these figures because when we're running into April, May, there was a large upturn in the number of secondary fires, so there's been quite a lot of activity going on in the background. Fires in non-domestic properties, again, there was nothing to report during the quarter. Casualties in non-fire emergencies, there was 1 in each ward. Steps, Christ and Muirhead, there was a that was a cardiac arrest, which I think Crew Commander Rennie may well have attended. And there was a trench collapse rescue in Glenboig. So that's a reduction on the previous year's figures and down on the 3 years average. Unwanted fire alarm signals, we had quite a spike within Ward 5, but that could be attributed to the Ian Nicholson Centre being used as a COVID vaccination centre. Obviously the cleaning routine, they use quite a lot of steam and stuff like that. So we were attending quite a few unwanted fire alarm signals there. Ward 6 was just much great change in the figures there. There was good work went on with Steps Community Fire Station with the local authority at the Ian Nicholson Centre, and they managed to reduce the figures before it was eventually wound up as a vaccination centre. Just to round up, the kind of activities I know, the deliberate fire setting has been an ongoing issue, but local crews have been going out, gathering intelligence and reporting known locations, fly tipping locations to dumpers and Zero Waste Scotland. We'd also like to make you aware that Keep Scotland Beautiful are promoting litter picks through May and June. And if any of your organisations arrange an event, if you could let the fire service know, we'll participate. We'll send down our community action team or the local crews from Steps, they'll participate. There was a fire at Horns Hill Farm. It was actually destroyed by fire, a deliberate fire, but there's no show in this quarter's figures because it happened after that. Community engagement activities, we've continued to do our high risk home fire safety visits, and we've been promoting our Make the Call campaign. There was good liaison between, it was actually the local area liaison officer from Police Scotland and ourselves, where we've got the local pharmacies within Glenboig, it was Glen Mavis and Gartcosh for distributing literature within the prescriptions. So we're hoping to extend that to the rest of the pharmacies throughout the area. I think 200 fire safety leaflets were distributed within Glen Mavis and Gartcosh following a rise in wheelie bin fires. So that isn't reflected in this report, but it will be in the next quarter's report. Our youth engagement activities, our community action team have been delivering fire skills virtual presentations to schools, and we are also looking to reintroduce our Fire Reach programme to schools in September, and North Lanarkshire is shortly introducing a youth volunteer scheme that will be based at Coatbridge. Our home fire safety visits, I think if you look at our report on the back page there, we've got the seasonal community safety calendar just for your information. And finally, the Chief Officer, Mr Blunden, will shortly be releasing his document, Future Visions, which is about expanding the role of the fire service. That will be out for a 6-week consultation from the 7th of June. So that will be circulated to all the partners and stakeholders when it's available. And this will probably be my last community board meeting for the Northern Corridor. It's Craig Campbell, the station commander. I'm moving back into fire safety enforcement. But on that front, I'll hand you over to David, and he can give you a wee quick view of what's been happening at the station, at Steps Retained Station.
Hey, David, carry on.
Perfect. Can everyone hear me okay, yeah?
Yep.
Yep, perfect. Yep, I'm David Rennie, one of the crew commanders at Steps. I'll just give a wee update on what has been happening at the station. So lately, we have just recruited 3 new trainees here at Steps. They are currently doing their training. So they should be available to start attending fire calls within 3 weeks when they finish their training. We're going to be looking at recruiting possibly another 2. We don't have a time scale for that yet, but we're looking to take another 2 on. So currently we've got that Steps, and then if we get another 2, that will take us to 14. Obviously that helps us a lot. It gives us more bodies on the appliance and more bodies at instance to attend. We've been doing quite a lot at the station, quite proactive with our home fire safety visits, targeting the high risk ones and people that don't have smoke alarms. So we've been making sure we're going out to do the smoke alarms, fitting them for folk. Also our operational intelligence, we're still been carrying out them through the pandemic. Just what Brian says about the cardiac arrest, that was at the Nicholson Centre. We were attending an automatic fire alarm at the Nicholson Centre, and on arrival we seen a nurse over a car who was requiring some help, and the nurse said there was a lady in the car having a cardiac arrest. So we attended, the AFA dealt with what had to deal with there, and we remained in attendance to make the casualty comfortable, provide oxygen therapy, and also have a defib standing by in case it was needed. We stayed until the ambulance arrived. The Hornshill Farm, we attended that maybe 3 or 4 times. The stables next to it was setting fire first. That was a well-going fire. The problem we had with that was that the roof in there is asbestos. When we attended on the 24th of April, it was the actual house itself that was totally destroyed by fire. We were told on arrival that there was youths seen round about the property not long before it was set alight. So we do believe that was set alight intentionally. So I think what else, if we've got anything else to update you on here. No, I think that's everything for the moment in the station.
That's fine, David. I've got a wee observation for you, and I'm quite sure everybody in Ward 5 and Ward 6 will support me on this. I would like to know where we are with the Amazon delivery vans that you're going to get. Is that off the table? Whether we're going to give you these rapid response vehicles that can't take a lake-on ladder? Is that being put to bed? And the second question is, out of all your crew, how many females have you got in the crew? Or have you advertised that females will be welcome as part of the crew?
On the first question, we've not been told anything about the rapid response units, that we're getting any of those. So I can't help you on that one. I've not heard anything.
I've been actively fighting it. I do not want one of them in my area. We've got Chestnut, we've got flats in Moodiesburn. The ladders won't. We need to go to the window cleaner to get any ladder if we're to get in a window there because they're hopeless.
Mr McLaren, the North Lanarkshire doesn't have any plans to introduce a rapid response unit at Steps. Obviously, the future visions document will be out, and we'll have to look at expanding the role and changing the station footprints and something like that. But there's no plans for a rapid response unit at Steps. And I'll let David talk about the females. There are proactive. What's the campaigns that are run? Where females can attend to get additional input for the recruitment campaign, so they will be. We can advertise them at the next.
That's fine. That's great.
Quarterly meeting.
Yeah.
Equal opportunities. Fire
I believe
service.
there's one female at the steps.
There is, yeah, there's one female, yeah, Kirsten McClure. Yeah, if we've got one female here.
Okay.
I think Anne Marie's looking to ask a question. Yeah.
Anne Marie, you're on mute. You're on mute, Anne Marie. Sorry, Anne Marie, you're not getting through, pal. Right, we'll move on to Inspector McLeod now.
Evening, folks.
Hi, Inspector, thanks.
Okay, I'll try and limit my update to a summary of crimes that I believe would potentially cause the greatest community concern. So I'll start.
I'm off mute. It's off.
Break up, Anne Marie. You're breaking up, Anne Marie. Inspector, do you carry on?
Okay. Yeah, I'll start off with just giving you an update. Some may remember that I provided in my update at the last meeting on the 22nd of February, that just in the days leading up to that meeting, there was a violent housebreaking at Greyston Manor, whereby males entered the property by force, assaulted the occupants before making off with a high-value items and making good their escape. The good news is that 2 males have since been arrested, aged 19 and 22. They were arrested, charged with that offence, together with half a dozen other similar crimes throughout Scotland. So they've been remanded in custody. In terms of since the last meeting, on the housebreakings theme, there's been several throughout our area. So the first one I'll bring to your attention is there was a high-value car stolen from Cardowan Drive on the 24th of March. This was since recovered in the Alloway area, and a 28-year-old male was arrested and charged with that one. We've also had 2 attempted housebreakings in the Hilltop Road area of Moodiesburn. Both of them took place on the 2nd of April, and we believe they are linked. There's no arrests been made at this stage, but inquiries are very much ongoing. There's a theft of a car from Alexandra Avenue in Steps on the 6th of May. That vehicle is still outstanding, and inquiry is still ongoing for that one. Another attempted housebreaking, this time in Drumlanrig, Crescent and Gartcosh. That again remains outstanding. Scenes of crime have been out, fingerprints have been retrieved from the locus, so we're hopeful of an arrest in due course for that one. There was a house broken into in Whiteford Road in Cardowan. That was on the 21st of May, with entry forced via the rear patio doors. The 2 males responsible for that, they were disturbed at the scene and seen leaving the location in a motor vehicle. So again, there's CCTV opportunities for that one, so we're hopeful that arrests will be made. Away from the housebreaking theme, an arrest of note in the Steps or Cardowan area. This was following a report of a sexual assault on a lone female who was walking her dog on a footpath at Cardowan Moss. This took place on the 19th of May. So we put in place additional foot patrols, plainclothes patrols in that area, and this resulted in a 53-year-old male subsequently being arrested, and he was charged with that offence together with 2 additional offences that were identified from speaking with dog walkers in the area, where the same male approached another 2 females who were alone walking their dogs and made inappropriate comments. So he's been charged with 3 offences, and he's set to appear at court. We had a willful fire raising to a shed in Gain Drive in Glenboig. There was a 27-year-old male arrested and charged with that one. 2 days ago, we had an 18-year-old male. He was arrested, having been found in the footpath in the Oval in Glenboig in possession of a knife. He again was remanded in custody. Onto drugs recoveries, there were a number of notable drug recoveries over the last period. There was a vehicle stopped on the 26th of March in Cumbernauld Road in Steps, whereby a 22-year-old male was arrested after cocaine with an estimated street value of £1,700 was recovered from the motor vehicle. On the 27th of April, a warrant was executed at an address in the Oval in Glenboig, and a 46-year-old female was arrested after heroin with an estimated street value of in excess of £700 was recovered from the address. On the 4th of May, a warrant was executed on an address in Cumbernauld Road in Muirhead, where a large-scale cannabis cultivation was recovered from the house. This had an estimated street value, believe it or not, of just over £400,000. There were in excess of 1,500 cannabis plants recovered from there. 2 males were arrested, aged 42 and 19, and again, they were remanded in custody. On the 5th of May, a warrant was executed at an address in Woodlands Avenue in Mount Ellen. A 22-year-old male was arrested from there after, again, a large cannabis cultivation, this time with an estimated value of £57,000 was recovered. In terms of other crime trends, fraudulent schemes by means of bogus phone calls or bogus emails, that continues to be a real theme, as it has been over the last year, I would say. We've seen a steady increase in this type of crime. So in an effort to counter that and to try and get the message out in terms of avoiding being caught out with these scams, just similar to what Brian described there, we've been engaging with our friends in the local pharmacies and trying to put out leaflets attaching them to repeat prescriptions, particularly aimed at the more elderly in our community, just to try and get out that safety message to avoid being caught out with these schemes. But other than that, that's it in relation to crime and crime trends. We've got our 2 fairly new community officers, PC Findlay for Ward 5 and PC Fleming in Ward 6. They are settling in well to the area, and I know they've been making efforts to engage with the local community groups. But if there is any community groups that are represented tonight and they feel that they could do with some increased engagement, then if I could ask, just get in touch directly with myself and we'll put steps in place to get that done. And that's it for me. Thanks, Chair.
Thanks a lot, Inspector. I'm going to come back. I'm going to take a step back to David Rennie. David, there a question come in from Anne-Marie, and you've got a question going to come in from Diane. Now, Anne-Marie wants to know about the beehives at the fire station.
Yes, we have the slabs in place, and I believe there is going to be a fence getting put up round about where the hives have to go. But that's as far as I know just now what's happening. I've not really got any more update on that. But the area is separate.
Okay, if you get an update, will you pass it on to Anne-Marie and make sure she knows all about it?
Of course I will, yeah, I'll get that done.
Okay. Now, Diane's want to find out about turnout times. Diane, would you like to come in?
Hi. I was just looking for some information about the delayed legislation around the new requirements for fire alarms and heat alarms in homes. Just looking for some confirmation about what it is we have to do and by when, and is there going to be financial support to allow houses to do what they have to do?
Brian, do you want me to answer this one, or?
Yep, carry on, David.
Yep. Yeah, so the new legislation, it was meant to be February this year, but it was delayed by a year. So February 2022, that new legislation comes in. The fire service are going to provide smoke detection, the Bluetooth connected ones, but they're only going to be going to houses that folk own, and they have to meet certain criteria for the alarms to be fitted. If they don't meet the criteria, we won't fit the connected ones. We'll put up standalone ones, and it will be up to the owner to get that put in. The criteria can range from elderly to folk that maybe have alcohol addictions or drug addictions or things like that. That's the only times we'll really put up the smoke detection. With help with funding and stuff, I'm not entirely sure with that. I don't know if Station Commander Kane might be able to come in on that for me. Yeah, Brian?
Yep, the fire service don't, it's like David said, will only provide fit Bluetooth detection in privately owned homes where the person is classed as at high risk. That's usually 50 living alone with mobility issues, and probably a smoker as well. Unfortunately, that's the only criteria we will fit them under. It's entirely up to the homeowner, or if you're in a local authority premises, it's up to your local authority housing provider or your landlord to provide that level of protection.
Is it right that you have to have a fire alarm in every room of your house now, with this new law?
It's not every room, it's every circulation area at each level, a heat detector in your kitchen, which is a carbon monoxide detector if you have any, like a gas boiler or a gas fire, and you need a smoke detector in the main room that people spend their time in during the day, so basically your main sitting room or living room.
Okay.
You can get all the information from the Scottish Fire Service website. If you go on there, you'll get a raft of documents there that give you guidance, and there's you can contact us as well.
Thank you. Thanks very much.
Okay, Diane, thank you. Right, we're going to move on to any other competent business, and Greg Lennon's going to come in because we've got, lucky tonight, we've got Andrew McPherson here and Michael McPake, and hopefully we'll take on board what Greg's going to come in on.
Chair, thanks very much for letting me in, but I wanted to come in on Neil McLeod's report, Chair, if that's possible, because I noticed that questions offered the opportunity there. Neil, I just want to commend you and your team's efforts on which can only be described as one of the most turbulent times in our country's history, and even probably in my lifetime anyway. I know how hard your team's been working, especially in my ward, over the last number of months, and I just wanted to thank you for your efforts and make sure that Jack and various others know my thanks to them. Thanks very much, Neil.
Okay, that's fine.
Substantive point here, Chair, in relation to that. We obviously have a community resident here tonight, Margaret Donohoe, and again, Margaret raised with me this morning in relation to significant issues and the problems of rats. I know it's been brought up at Environmental and Transportation Committee and various other stuff over the last few weeks. I know Willie Doolan has been very, very vocal on the subject matter, but I thought it important that one of the local residents have the opportunity to raise concern and raise issues that they're experiencing as it stands right now. So I'll pass over to Margaret to
Okay, Margaret, carry on, Margaret.
Thanks, Mr McLaren. It's just to say a wee point and to see what's happening with that infestation that's in Moodiesburn at the moment. No matter what street you're going to, there are rats in it. 90% of the community is upmanned about this. I've been on to North Lanarkshire Council myself. Behind my back garden there is a small park which has got trees in it. We know the rats are there. We've been out, we've seen all the rat holes. There must be at least 15 rats hole. Billy Doolan came with me, I phoned him up. I went back on to North Lanarkshire myself. I was told they weren't dealing with any of the parks at the moment. If I wanted to pay to get someone out, I says, I'm already doing that, I've done that, I've actually put poison down myself. Now, I'll give you an incident. In the last 3 weeks, we can't sit out in my garden. My dog's killed 6 rats. The neighbours has killed rats. The houses round about us, inundated with them. They're putting poison down. Can Emily explain what's going to happen with the rat infestation in Moodiesburn and what they propose to do?
Okay, thanks for that, Margaret.
Thank
Michael
you.
or Andrew, would one of you like to take that on board or give Margaret some sort of comfort?
Certainly, I can do that, Chair. I think I've spoken to Councillor Doolan, I think Councillor Lennon as well, just on the very matter you've raised. The reason the rats are there, there's a food source there. It's the only reason the rats are there. They won't survive that food source. So we need to identify the food source, and that's when we have people that come out, pest control officers. They don't just put down the poison and the bait and everything else. They will try and establish what is causing the rats to be there. And it's 9 times out of 10 they can identify that, and it tends to be people feeding birds excessively in back gardens, rubbish not being stored properly in back gardens, that type of thing. The problem that we've got, if that food source is still there, the rats don't take the bait that we put down. Why have mince when you can have steak? So they'll go after their normal food source. In terms of the infestation on the area of ground that you're talking about, again, it's important that we remove the food source so they start taking our bait. We can't go in if it's private ground as well. We need to identify who the owner is, and we would ask them to undertake that treatment. The council can't go into private ground unless the people refuse to do that. So what we would do is I would urge anyone who's got a problem with rats in their gardens, whatever, to contact the council. We will undertake a full treatment until it's eradicated. But we will also look into where they're potentially, if they've identified where the source of the rats are, we will also undertake an assessment of that land. If that land's in council ownership, we'll deal with it. If it's not in council ownership, we'll contact the landowner and ask them to deal with it.
I want to stop you right there just for a wee moment. Now, the land is North Lanarkshire Council land. It is actually was a swing park at one point years ago. Now, due to this piece of land, it's now a walkway through from one side of the street to the other through Lavrock into Bridgeburn and Lavrock into Earls Court. Now, this park isn't a big park. It's got one corner where there's trees there that's never been and has never been in the 22 years that I've been here. The council have never trimmed them. We've went into these trees as for self, and now I'm estimating, and Mr. Doolan will confirm it, there must be at least 15 to 20 rat holes in there. Now, going round this piece of where the trees are, now there must be about 10 houses, and every one of us, if you come round our backs, there's not one bin outside our back. We've now issued the bins to the side. The rats are actually eating through the bins. Nobody has got any bird seed up, nobody's feeding the birds. We've put traps out. What I'm suggesting is when the council went down to work with the water pipes down at the Glen, which we're right next to, it was disturbed, plus all the digging up for building new houses, the rats have moved. It's not just in my wee area, it's in the whole of Moodiesburn. If you go to any street, they'll tell you that if you chat the door, they've got rats. There is an infestation and we can't control it ourselves. We're trying, but it's not working. As I said, North Lanarkshire Council told me, yes, it's their park, they cut it, but they will not attend to the rats just now. Is that not that's not priority on the parks at the moment? Now, we're looking out our back, and I guarantee you every morning, because when I got up to go to bed, we must have counted at least 15 rats a day. Now, some of these rats, they're massive. They're eating the poison, but they're still here. I mean, we're putting poison down every single day in our back gardens, in traps, under deckings, underneath these trees. It's not killing them.
Okay,
It's
Andrew,
just there is a problem.
I know the park that Margaret's talking about very well.
Yeah.
And it is quite wide and open, apart from that wee corner. So would you have a look at that as a priority?
Yeah.
Thanks, Councillor McClan.
Yep, we can certainly do that, and I think the department you've been speaking to, it sounds to me as if it's not the department that deals with the control of the pest control, so that's probably so apologies for that, but we'll
My
have
problem, Mr. McPherson, is sorry to interrupt. There's a few of the houses, there's young children, and this is where they play. And growing up, they think they can make a wee den in here. We've done it ourselves, and we're constantly out saying, telling the rains to go away. Terrified case they get bit or they touch any of the urine or whatever, and then the kids become not well because they're only wee tots between 5 and 8.
Okay, thanks for that, Margaret.
Thanks very much.
That's no problem, Margaret. Wally Dolan.
Thanks, Chair. Chair, I've got to concur with the comments Margaret there with regards to the rats. It's rife throughout Moodiesburn, and just for Andrew's information for Andrew on the point that Mags had raised about this park, I have raised this issue with Alistair Lee, I think it was last week, and Alistair has agreed that they will get the area looked at and inspected. But Andrew, it's not a gang up Nepal or anything like that. It's reality in Moodiesburn at this present moment of time. Andrew, I've said it at the environmental meeting which you were at. I've lived in Gart Ferry in Moodiesburn for over 60 odd years, Andrew, and I can assure you, throughout my lifetime, I have never seen a rat in that vicinity. I'm getting bombarded. I'm getting bombarded with people. I've had a woman that has actually videoed a rat scurrying across our kitchen worktop. This is a 70-odd-year-old woman living with a grandson who has autism. The woman petrified, Andrew, petrified, scared to stay in her own home, vacated her home and went to stay with her sister to give time for to give time for the debate, etc., to work and hopefully catching these rats. Andrew is on the increase. I can assure you, I give you my word on that. People are petrified, even children. Andrew, I caught a rat out my own back. The rat was caught in a trap. Despite the rat being caught in a trap, it's dragging the trap the length and breadth of the garden. That's how serious the situation has become, Andrew. Now, I mean, I reject the concept that it's the infestation is based purely in the COVID concept. I reject that, Andrew. I reject the fact that the rats are now scurrying into our gardens, our yards, etc., in the hunt for food. I don't doubt they're hunting for food, but Andrew, it's people's perception here in Moodiesburn, and we don't believe it's coincidental that the rats have just suddenly appeared through this COVID. Andrew, Margaret touched on the point earlier on about what's the word I'm looking for? The replacement sewage pipes down the Glen in Moodiesburn. We've seen an upsurge in the community of rat presence, but we also, Andrew, we see it's not coincidence in the people's opinion that the new developments that are taking place, for example, one that's kicked off recently has been the development for Miller Homes in the old Stoneyetts ground. Now, I know, Andrew, we've had dialogue about this before, but it's a very, very serious situation. This is land that has laid dormant for 25 years and all of a sudden is being excavated. The wildlife are having to hunt for new homes, and unfortunately, they're coming up into our community. Please, Andrew, I'm asking, I'm pleading on behalf of the people in Moodiesburn, please help us, Andrew. We're a community that has very little, Andrew, but we want to get rid of these rats. Please ask you and ask the council. Thank you.
Okay, Andrew and Michael, I hope you'll take that on board, and we'll get an update at the next community board meeting about the rats. Now, there are two more speakers, and that's us, because we're running out of time on this again. And Greg, I'll let you in first, as long as it's not to do with it, it's to do with the Nicholson Centre. You were asking about something.
Aye, Chair. Sorry, I've heard a substantial rumour in relation to local community residents that the Nicholson Centre will potentially be closing. It's just asked for confirmation if there's any.
No, we taken decisions, Greg, well, not going way back into things. We taken decisions last year at the budget that there would be no closures within this year in North Lanarkshire. So that's not closing.
That's good, Chair. I'm glad that all elected members can stick mantra around.
Yes, that's the decision we made at the budget last year. Okay. Carl, let you in for the last question.
Thank you. I just want to go back to point 4 on the agenda, the Chair of Community Board arrangements. John Wilson was supposed to be on tonight, but he's not here.
He's in for his redundancy money, Carl. You don't get redundancy money after one meeting. If you want to put your name forward, I'm quite sure Matt will contact you.
No, what it is, I think the treatment that John received after the last meeting will put the majority of other community people off putting their name forward. The fact that he was called in and in his words chastised for the way
Carl,
that he.
I'm going to stop you on that. We can't discuss that at this meeting.
Well, I think it's relevant in the fact.
Sorry,
no, but
Carl.
I think it's relevant in the fact.
You can't speak over me, Carol. I'm going to explain something. John's not at this meeting to defend his seller, put his case forward, so therefore we are not discussing it. Okay? That's the final word on it. We are not discussing it without John Wilson. The date and time of the next meeting, that's to be arranged. Thank you very much for your attendance, and hopefully, Brandon, I'd like you in.
I was going to say, but basically these meetings happen once a quarter. Why can't we have the next meeting date now?
It's still to be arranged, Brandon.
No,
That's
Chair,
the way
the meeting date is on the agenda. It's the 26th of August.
Right, I've not got that.
It's
Sorry,
not on
Chair.
the agenda.
Sorry,
I've not got that,
it's on the notes we have. Sorry, it is on the notes.
That's
We've got
okay.
the notes. 26th of August. Apologies, it wasn't
26th
on
of
the.
August, and hopefully you will have a chair in place. Brandon, Carol, if you want to put your name forward to chair the meeting, contact Matt, because the community are in charge of these meetings and you've got to take ownership.
John, can I speak, Isabel?
Certainly, Isabel. Where are you? There you're there.
Okay. John, as you said, the community is in charge of the meeting.
Yes.
So could we maybe decide when it ends? We've got any other business, and I put forward.
Well, we'll put in any other competent business.
And I also put forward the community survey onto the agenda in the hub.
I've not got that. Carry on, Isabel.
Okay. We conducted a survey on the community hub and gave the results into the council, and we gave a copy to Greg Lennon. We also took a presentation of the community hub in Christon, which was presented to us. I would like to raise my objection to that particular presentation, in that we could only speak through the chat bar. We could not speak at the meeting, and it would have been helpful. There was a number of young people who had disabilities who maybe wanted to participate, but because they didn't have the written communication skills regarding the meeting, they couldn't participate. And instead of taking a view of how many people would want to look at the presentation and then arrange specific meetings to meet that demand, we were given a presentation which we couldn't interrupt or make comment on unless it was through the chat bar. The second thing was the presentation came out as the community, as the town hub at Christon. Now, we had already sat through 2 other presentations by the council who told us that there was 8 town hubs and that we wouldn't, the Northern Corridor wouldn't have a town hub. And then suddenly we're told, without any consultation, without any discussion, that this is the town hub for the Northern Corridor. Now, Gartcosh, if I can bring the school into it, we're down as a priority for the school. The hub will become a factor in that, because we sat with Des Murray for 2 hours in Cumbernauld, and we actually bought into Des's vision in terms of the Community Investment Fund for communities, along with, he said, no buildings, standalone buildings will be looked at. We're looking at community hubs to create a critical mass for the school and for amenities. And we had the Education Committee meeting regarding the school, where we had the famous phrase that's used in all things Gartcosh, sorry, it's commercial and sensitive. For 10 years, everything that is important in Gartcosh has been commercially insensitive because of the community growth area. And when we looked at the presentation against what the actual community wants, we know that we will not get the amenities that we need in this community. So what did we do? We went and contacted Springfield Development, and Springfield Development own the old Gartcosh golf course. And the owner there stated that he would give his land to create communities, community facilities. while I was having the discussion, I asked him, had any of the council approached him on the issue of the school? And he said no. And he offered the site as a school site. Now, I think it is absolutely appalling that we have waited for a school for all this time. The council say they're actively seeking is the words that it describes, a new school site, and it's commercially sensitive. Now, we've looked at the playing field site, and at the same time as looking at the playing field site, it was documented in the public domain about the council seeking land for the school. At the same time, the developer put in for 72 houses. Now, that is the lever by which they are raising the price of that school up. Now, the development land in the golf club is not in the development plan. In the modified plan, it's not there. So it does not even hold the same value as what these other developers are trying to charge the council. Now, there's a clear opportunity here for the community to get the school, to get the amenities, and we're not looking for the council to run these amenities. We're looking for the council to work in collaboration with us so that the community can run the amenities that they feel fit for this community. And there's a clear opportunity there, and not one person in that council has lifted a phone and even asked if that was a possibility.
Okay, Isabel, take that on board what you're saying, Isabel. I'm going to ask Matt and Leanne if they would.
Well, Des Murray will get a letter from me first thing 9 o'clock.
That's okay. I quite agree with you. Gartcosh does need a school, 100%. So Matt and Leanne, if they take that on board, that if they can get in contact with Springfield developers, where education can also look at this, but we're not going down the realm of education. Now, Greg, were you wanting back in?
I was, Chair, thanks very much. Touching upon Mrs. Kelly's points here, I think that one of the biggest issues that we've had is there's been one identified site in the entire process, despite numerous opportunities to try and identify several, and it was honed down to a statutory consultation where there was just one identifiable site. Now, the position that we find ourselves in Gartcosh in particular, that Springfield Developments in the golf course when Mount Ellen closed its doors was offered as an opportunity. I was advised, Mrs. Kelly, that at that time the officers were currently liaising with Sandiana. So I don't know why matters haven't progressed today, to be perfectly honest. But what I would like to remind this community board of is in December or November last year, both myself and Councillor Dillon put forward a motion to full council that Gartcosh and Moodiesburn would be formally recognised in the eyes of this council as small towns, and they would carry small town status. So what my proposal would be is if Leanne and Matt are going back to education to establish where their most appropriate site is if we can establish as what Christen is currently getting in relation to a community or a town hub, that we have adequate resource within that facility to provide local amenities, because Gartcosh, again, in my opinion, as it stands by seeing looking at current plans, is not getting the credibility of that small town status. And I think that we have to recognise formally within this forum that go for small towns.
They'll be put forward to Charles McCabe in education. But before that, Greg, I think we'll need to have a discussion with the golf course. If the golf course is in Ward 5 and Ward 6, that's a discussion for another day.
To clarify, Councillor McLaren, it's in Ward 6. It's in Ward 6.
Well, maybe half it is. Right, okay, that's fine, thanks. That's us. We've now came to the end of the meeting and we've got our date for the next meeting. All I'm asking is, can you get yourselves organised and get a chair for the next meeting? Okay? Thanks very much. Greg, you want back again?
Chair, last point, my apologies. It's a point of clarification I was coming in at when you extended the meeting a while back there. If there's no identifiable chair for the next meeting, how's this going to work then? Is there an automatic default position that you will chair a meeting? Or is it a case How's this working?
I'm doing it tonight because we were let John Wilson has resigned from he's out the forum and he's resigned out of the other thing he's on, so John can't do it. But it's not, it's a community. This is for the community, and we want the community to embrace us and take it forward.
Can I just clarify one thing there? He stepped down as chair from the forum, which I have been elected as chair of. He has not stepped down from the Development Trust, so he still can stand as chair.
Right, that's okay. Well, if John wants to, it's an evolving chair. Where
yes, but at the same time, whoever is sitting in chair must be respected in that position, and the officers of the council must remember that this is for the community and not for the perspective only of the council.
Obviously, Carla, the officers have to give respect, but whoever's in the chair also must give respect to the officers, and we're going to end it at that.
It's equal way. It's equal way. But whoever is chair should not get pulled in for their way of dealing with it for chairing.
If they've not done their thing properly, they've got to get spoken to. If an officer speaks to somebody disrespectfully, they'll get spoken to. So thanks very much for your attendance tonight, and hopefully see you at the next meeting with a new chair. Okay.
Well, thanks, the chair.